That's a big question, isn't it? I think, to be honest, it is probably better done in the review situation when, as Chief Minister has announced, there will be a review and we can reflect. And I think a lot of our own personal memoirs will become part of the repertoire that people, future generations, can be able to look at. Certainly from my point of view, the first few weeks were horrendous. I saw the tsunami coming, and I had to make sure that everybody else could see the tsunami coming. The amount of nervous energy, I just couldn't sleep in terms of the risk that I saw coming through. Remember, I have over 30 years of experience. I've been through a number of pandemics, being the pandemic lead for East Lancashire, for example, when we had flu and arranging the vaccination. So I had a sense of what was coming, and I could see it much more quickly than perhaps other people who didn't, who just thought it was just like another flu. And then the galvanization of the population, I think, happened as a result of the buy-in by the politicians. Subsequent to that, I think the most challenging time, I think it was said in Parliament, the most challenging time is actually later on in the pandemic, when everyone thinks they're the expert. So in the early stages, no one knew what was coming on. Now in the later stages, everybody thinks they're the public health expert, and that becomes much more contentious and much more difficult. The patient is the population for me, and everyone knows that Gibraltar is unique, as Malta is, as the UK is, and you have to therefore, as the doctor, know your patient in order to allow the right medication to be administered at the right time. And part of that is obviously bringing the leaders in on it, and sometimes leaders are resistant.
In your tweets, when you announced that you were leaving, you expressed some sadness that your contracts hadn't been renewed. Would you have liked to have stayed on?
Gibraltar is a beautiful place. The people are wonderful. Once they take you to your heart, there's no holding back. So of course I'm sad at leaving. Inevitably, from a public health point of view, I didn't come here to do the pandemic. I came here to do public health work, and so there's a lot of undone work that hasn't been started or hasn't been completed. We just did the health and lifestyle survey, for example, and there's a lot of work that needs to come on. So of course I'm sad, but you know, all good things have to come to an end, and I think the Chief Minister said he gave the reason as to why that may and might have happened, and I'm not going to contradict the Chief Minister.
In your time here, particularly during the pandemic, you've been known for being quite loose when it comes to social media. Is that something that you regret, or something that you feel you could have done differently?
Well, of course, it's a bit like any conversation you have and you go back and you think, gosh, I wish I had said that differently, or I wish I had said it better. And I'm no expert on this, but what I do know is I've got some responsibilities. It says in my job description that I must, in fact it says in my contract that I must involve my patient in their treatment and their treatment plan, and it says in my job description that means my patient is my population. So I have to have a dialogue and a conversation with my population. Whilst I can do it through press releases and etc., that's not a conversation, that's a telling. And most of us know that you do have a conversation with your doctor and say, well, actually what you're saying isn't right, this doesn't apply to me. So it's quite a useful way. Social media is quite a useful way. Of course, every single tweet I could go back and nitpick. The point is that I'm telling a story and I'm having a conversation, and in that conversation I hope people have realised my heart's been in the right place. I've been trying to help people. I've no desire to frighten people. I've no desire to anger people. Obviously we have keyboard warriors as they have everywhere else, and the keyboard warriors are brave in front of their keyboards.
You also gave us some ominous words about the autumn in particular, saying that it would be quite traumatic. What exactly did you mean by that?
I may give out bad news, but it doesn't mean that I believe in the bad news. I just want us to be wrong. And there's a sort of accumulation of issues that will all happen roughly at the same time. We're currently getting infections in the vaccinated and the unvaccinated. What is clear is that when the children are back at school, and anyone who's got children knows this, when the new session starts, everybody's running around with streaming eyes, colds, coughs. That's the season for it. And so the children will act as transmission bridges between the positive cases of Delta. So that will mean inevitably there will be an acceleration of the rise in Delta cases. We also know that in Israel they took a 3-week gap like we did for the Pfizer jab, and they are now beginning to report some decrease in immunity. Fortunately, at the moment, not hospitalisation, but it is age-related. So that's something else that we will need to watch out for. Then, of course, it's flu season. I've already mentioned it's seasons for upper respiratory tract infection. I also know that our healthcare system is under duress. It's tired. People have worked for a very, very long time. So there's a sort of panoply of different issues that are all beginning to happen late September, October and onwards, and we haven't got the luxury of suddenly expanding our capacity to be able to deal with these things, and obviously whilst you can buy in expertise, it takes a while for those people to be orientated. It doesn't just happen like that.
And finally, you are to be awarded the Medallion of Honor. Tell us what your thoughts are on that.
I'm only a symbol, and what I did was try to bring lots of people together to be able to work on this pandemic. So I take it on behalf of everyone else that worked really, really hard, and I'm honoured and to be recognised for what should be, as Chief Minister said, lifetime of achievement, but it certainly does feel like I've lived in the 18 months a whole life.